It's it says it's live on Facebook right now.
Great. Let me let
Corner.
the audience in. Hold on, give me 1 second. Okay. All right. So go ahead in the chat and allow the person in. Yeah, that's okay. Okay, great. So we're live and we're ready. So welcome everybody out there in social media land. We are the Flint Public Health Youth Academy, a dynamic group of young people who understand the importance of public health in our everyday living. And we're here today in our talk show series, which is today a youth perspective as we focus on what is public health. So we're so excited to have some of our interns and our mentors and some of the students that we mentor through some of their other youth organizations in the city on the live. And so I'm Dr. Kent Key, and I will serve as the host and the facilitator for today. Now I know usually the young people are the ones asking the questions, but the last two shows I really wanted to get out of the youth's perspective. So I've decided to moderate this talk show as well. So we're excited today. We're going to talk about public health. We have some young people from the Flint Public Health Youth Academy. We have some young people from WOW Outreach, youth ambassadors, and then we have some other folk who's going to join us, some of our mentors from the Flint Millennials, and then some of our staff for the Academy are all on the line. So we're excited. Ask everybody to please take your, if you can, take your video so people can see your face out in social media land, and we're excited to get started. So my first question to you guys are, when you hear the words public health, what is the first thing that comes to mind? When you hear the words public health, what is the first thing that comes to mind? Go ahead, Kayla.
I would say for me, the most obvious things when I was introduced to the Flint Public Health Youth Academy, when I thought of public health, I thought of the water, the air, things that are impacting people of like communities all at one time. But now with a greater understanding of what it is, when I think of public health, I also consider mental health. I also consider dynamics within the home. I also consider things that make up smaller communities, which then contribute to society as a whole.
Great. I see Tomas' hand up. Go ahead, Tomas.
Hello, everybody. When I hear the word public health, you know, kind of after now having a more educated definition, thanks to Dr. Key and the other interns and mentors that are here with us, I think of the world, to be honest with you. I just think of every like way of life and every factor in it, you know, puts you back to public health. Just listening to music deals with public health, you know, getting your mental health and all of that. It's not just going to the doctor's office or going to Hurley or anything like that. It's more than that. It's social services, you know, your DHS offices and stuff like that. You know, it's about just church can be public health, you know, just getting whatever it is that you need to help be your medicine, you know, to clean you, you know, whatever it is you're going through. That's just what I think of when I hear public health, medicine.
All right, Naya.
Hi, thank you for having me today. When I think of public health, I think of health equity. I think of how a community defines wellness, how a community defines, at the core public health, I think that it has something to do with justice. And I've heard quotes about what justice is, and it's love out loud. Like it's love in our streets, there's love in our communities, love all around us. So like Kayla was referencing and Tomas was referencing, it's in our community, it's in our air, it's what makes us healthy, it's what makes us unhealthy, it's what makes us around us a whole human being in a whole community.
All right, I see Cruz's hand up.
So like what everyone else has sort of hinted at so far, the first thing I immediately think of is community, whether that be city, state, nation. I think about how people interact with each other and the type of impact they have through different things, whether that be, you know, contact or, you know, mental health support systems, things like that. And I also see how that impacts research and how you can discover and find out ways to prevent potentially, whether that be disease or infection and other things like it.
Anyone else? I see Lauren and then Jasmine.
Do I have a minute to tell a story? So I heard a story recently that I thought explained public health really well, but it's an analogy. So the story is about a group of young guys who are down by the river having a party and a bonfire. They're sharing a drink, hanging out, and while they're down there enjoying themselves, they look over to the river and they see a kid floating down the river, can't swim. They see this dude bobbing and clearly needs help. So one dude jumps in the water, saves him, and they go back to partying. A few hours later, another kid comes floating down the water. So one of the guys stops partying, jumps in the water, saves the kid. Throughout the next few hours, more kids come floating down the stream, clearly can't swim, and the guys keep jumping in the water trying to save them. It wasn't until one guy stops trying to save the kids and goes walking upstream that one of the other guys says, "Where are you going? There's kids here to save." And the guy says, "I'm going upstream to look for the guy who's throwing these kids in the water." So I think that you need to have someone who's looking out for the cause of the problem, not just solving them as they see issues arise.
Thank you. So public health is definitely upstream interventions. Jasmine?
Yes, that is exactly what I think about prevention. I love that story because I think about health disparities and I think about systemic racism and how public health can work to kind of undo some of that through prevention, whether it's primary, secondary. I see Aquavius's hand too. I think that's how you say.
Quavius, go ahead.
Well, when I hear the word public health, I think of it as a community as a whole. Like, say I'm an outsider coming from, I don't know, Neverland, and could I come to your community and feel safe and like healthy, and like could I go to the hospital, get a checkup, and come out healthy? And like honestly, like just thinking of it as a whole, like, are you safe in your community publicly? Like, can you sit on a bench and just read a book safely and be healthy in your community? Can you do that? That's what I think when public health comes to my mind.
Great. Everett?
Like everybody else, when I think of public health, I think of the community, and how the community feels when it comes to certain things, like when we have government officials and like stuff like that and policy. I think that public health is really how people feel and how people deal with how they feel.
Got it. Am I missing anybody else? Great. So we're talking about how we feel about public health and what words come to us, but what actually is public health? What is public health? Go ahead, Kayla.
I always feel like we're playing double dutch, like waiting to see who's going to jump in first.
Yep.
But I would say public health, therefore, after hearing all of these wonderful examples and stories, and what comes to our mind is a combination of all of these things. It is mental health. It is also preventative measures. It is do you feel safe in your community? It is the air. It is the water. It is what's impacting your community. It's quite literally, like, it's hard. Dr. Key, I think you were talking about this yesterday in our personal meeting. It's hard to think about any societal issue and it not in some way be connected to or involving public health.
Absolutely, absolutely. And when we, go ahead, Cruz then Everett.
Yeah, the easiest and simplest answer is to say that public health is everything. It touches so many different parts of life. And that's because your health impacts your life in every sort of way. I mean, they're intertwined. And so what it comes down to is, whether it be the types of transportation you have, there's a factory nearby, all those different elements that could potentially, impact your health or the way you think, or any sort of sense of environmentalism or things like that. It's going to have an impact on you. And because of that, public health is going to be there. And truly, it's important to see that it connects to everything, because then it can sort of seep in and have a true impact.
Yeah, like Cruz and Caleb were saying, public health is everything, like literally everything. And like the more and more I learn about public health, the more and more I see that in like just daily life when I'm going to school or I go to work. Like you just see how public health is really intertwined with everything.
Anyone else?
I think in a very simple way, I think of it as our simple existence, how we still exist in different spaces, different systems. How I came to public health was through a researcher, through Dr. Vicki Johnson Lawrence, and one thing she really emphasized from like the whole recast team was its complexities to the solution, its complexities to generations of change, generations of what we think of solutions, because right, just during this time, how we think about moving forward and being sustainable is a constant evolution of ideas, a constant evolution of progress to be made. So I think it's simple existence, and we're constantly redefining it. We're constantly defining what is it. But the fact that we're redefining it means that we can reimagine it and we can make it for our future.
Absolutely. Go ahead, Amir.
I think a lot of it is also about like the resources you're able to get, also through like public health and everything, like doctor checkups. As what Tom also saying was like different types of services like church and everything like that, social services, all that other type of stuff, to really help the mind and help the body. So.
Absolutely. So I remember when I first became a doctor in public health and I went to one of my family reunions, I had a little cousin that said, "So you a doctor, huh?" You have them little sassy little cousins, about 6 or 7. And I said, "Uh-huh." And so she said, "Well, do you give people shots?" I said, "Nope." She said, "Well, you ain't no doctor," and then laughed, right? And so then it dawned on me that people really don't know the difference. And so then I explained to her and some other families the difference between a doctor of public health and a regular medical doctor. So when a medical doctor sees a patient, they see it's a one-on-one ratio. They diagnose one patient at a time, right? The patient comes in, "Hey, doc, something's wrong. My throat is scratchy, or I'm having headaches." They have an issue. The doctor diagnoses them, then writes them a prescription, hopefully, that can solve the problem when they leave, right? That's normally how a medical doctor operates, on a one-to-one ratio. Well, a public health doctor doesn't have a one-on-one ratio. We diagnose an entire population or an entire community. So everything you're seeing now with COVID, when they talk about Dr. Fauci, they're not necessarily bringing him in because he's a medical doctor only. They're bringing him in because he's a public health doctor. He has that expert as an epidemiologist, right? And so public health doctors don't diagnose one person at a time. They diagnose a community, a group, or a population. Another term they use is population health. And so what we do is we find out what's wrong. It could be an outbreak of something in a set community. So we use data and research studies to gather our data, right? And then once we find out what it is, instead of writing a prescription that you go to the pharmacy to get filled, we either create programs or interventions. Those things are the things that we then put back in the community to address the problem. And so that's kind of like the difference. And then there are 10 essential services in public health, but if you remember 3 core functions, one is assessment. We assess the overall health of the population. If something like COVID it comes into place, or the Flint water crisis that happened was a public health crisis, we assess what is happening. We address the issue with interventions, programs, studies, etc. And then we also create policies. The next piece after assessment is policy development. We then create policies to try to prevent those things. A lot of things, the thing about public health is, unlike a medical doctor where you can put on like the surgeon outfit or the white coat and have the stethoscope around your neck, public health doesn't have what we call the Halloween costume effect. How do you really dress up like a public health professional? Like, what do they really look like, you know? And so you have to really teach people what it is. So we then, you know, create policy to do that. But then there's a next level is assurance. Then what pieces do we put in place to assure that those policies are carried out and that everyone has an equitable right to live their very best life? So those are just some quick things that you can kind of remember when we talk about public health. I see Jasmine had her hand up, then we'll transition to the next question.
Well, you already said it. I was just going to throw in the policy piece because like Kayla was saying, everything we've talked about is public health.
All right. And that was one of our interns who's not on today just yet, Asia. We did an interview with one of the media outlets, and one thing they asked her was, what is public health? She's like, public health is everything. She's like, it's what I drink, it's where I live, it's the built environment, it's the air I breathe, it's the food and healthy food access. It's, you know, when you think about it, every time y'all get in y'all car, the first thing you have to do is put on your what? Your seatbelt. Exactly. I see y'all making that's public health. But people don't think about that's public health. If you're riding on a motorcycle or a moped or even a bike, you're supposed to wear a what? A helmet. That's public health. But people, I don't think that one thing we have to do in public health is do a better job of branding the things that we contribute to society so that it becomes more visible. So the next question is, now that you know what public health is, why is public health important to you as an individual? Think about your experiences. Think about what you've been going through, even within the last year. Why is public health important to you? Go ahead, Christian.
So we made out that, you know, public health is everything. That means everything can affect public health. So that means, you know, the way we deal with pollution. The Flint water crisis is one, you know, that hit me the hardest in, you know, recent years. But it also means things like, you know, racism, bigotry, you know, police reform need to be done. Just general things that affects everybody's lives that you might not affect just directly your life. That's, you know, what public health really affects how, you know, how I live.
Thank you. Quavius?
Well, public health means a lot because it can keep you safe. It keeps you safe in general, like overall. Like you wouldn't be alive without public health most of the time. Just like the analogy you made about the seatbelt. If you didn't wear a seatbelt and you got into a car crash, you probably 10 times out of 10 you'd fly out of the car. So, I mean, public health can save your life. It can keep you safe. It all varies on what you're doing.
All right, I see Tomas and let me see, Tomas, who else has their hand up? Because I'm not catching everybody's hands. Tomas, Alonzo, then Nia. Okay.
Well, public health, oh, my bad. Well, public health is important to me because kind of like what everybody else is saying, that it's everything, you know, and we wouldn't live without public health. If you think of it way back in the day when our ancestors were living, they had their public health, they had their spiritual healings, and they had their natural medicine and whatever have you. So it's a necessity to live, you know, and it's unfortunate right now because a lot of communities like the ones we are living right now in, we don't have all the basic necessities, which is why our public health leaders, such as Dr. Key, Ms. Kenyatta Dodson, Dr. Mona Atisha, and all the others are really crucial to help have our voice heard and help, you know, nourish us with this information and knowledge so that we can, you know, respectfully take their position, you know, and one day and be like them and further contribute to the society. So yeah, it's food and water. You know, that's what is public health. It's food and water, basically. So without it, you can't live. That's just what I got to say.
Everybody just took the words right out of my mouth. But also with today's COVID, you have to wear a mask. That's public health. To make sure that you're safe and make sure everybody else is safe around you. So like practicing 6 feet, that just makes sure that everybody is safe around you. You're safe most definitely, and just like everybody is just safe. Period. So that's That's about it.
Thank you. And then we had Naya, then Kayla.
Yeah, it's important to me because I'm a policy person, so like I need that reassurance. I need that checks and balance to make sure that my little brother can go to school next day. My little brother has the things he needs to be successful. Like I think of the policy we walk through. I think about the spaces we're constantly going to the store about. We're going to these different spaces thinking about like that's our armor. That's how we have our that's how we express our agency over ourselves to protect our community, to look at ourselves and be like, I can protect who I am, who I have around me. I think it's our safety armor, and like they were saying, like how we pass it on, like how we pass on our armor. Yeah.
Okay, then we have Kayla and then Tiana and then Jasmine.
So for me, I've always been an extrovert. I've always been a people person. I've always loved people. And so when I was exposed to the disparities that existed and access to resources necessary to survive, that hurt me personally because I love people. And so to know that my people, because I consider everyone my people, to know that my people, more specifically those in marginalized communities, those in disenfranchised communities in America, to know that they were struggling on a daily basis, so personally from household to household, and that there were common struggles and common causes, and to exist in a space of privilege in many ways, because I have access to resources that are deprived from other people, that other people are deprived of. I felt I would be doing a disservice, or I would be remiss to simply ignore the existence of people in my community, people who live within 15 minutes of me, who are living completely different lives than I am. And so as a lover of people, I just think that it's my duty to be active and to do anything that I can, anything within my power to extend the privileges that I experience to others within my community.
Absolutely. Tiana?
All of their responses have been very well said. And as an extension of that, public health is important to me. As Kayla was saying, to address health disparities to improve healthcare outcomes for underserved communities. As a double minority and African-American woman, right now the maternal health crisis is an issue. Black women are dying ridiculously in what's supposed to be a very developed country. So when we have these inequalities between races that are preventable, we need someone to advocate for the mom who in Georgia might not receive the proper information or help in regards to contraception because of beliefs against that. So public health, I see it as important as an advocate, and I see it also important as an evidence-based way to say, without opinion, this is a problem. And it's not a problem because you're Democrat or you're Republican or you're independent. It's a problem regardless of your background. It's what the numbers are saying. It's what the information is telling us.
Absolutely. And just to piggyback off of that, when we think about it, I always have the conversations with the young people, and I always ask this question, other than your genetic code, what's the next predictor of life expectancy? Who can remember what it is?
Your zip code.
The zip code. So for me, public health, I got into public health because people who looked like me that lived where I lived were dying at disproportionate rates. Like people of color were dying at greater rates from stuff that was preventable, like diabetes and heart disease and stroke and so many things. And when I found out these things were preventable, and they were people who I loved, who were a part of my community, who were part of my family, who were part of my church, I'm like, Kayla, I took it personal. And then I did the research and found out that people of color, specifically African Americans, make up less than 6% of the medical doctors in the United States, We make up less than 10% of the public health workforce. And I think it's even like 6 or 7% in nurses. We have some of the lowest numbers, these marginalized communities, but yet we have the highest health disparities and the highest mortalities because of those disparities. And so that's for me why it was important to create this academy so that all students could learn about public health medicine and research early, but specifically wanted to make sure that we expose youth of color to this because we're grossly underrepresented. All right, anybody else wanted to respond? Go ahead, Cruz.
See, I was waiting patiently, but y'all started to cut into mine. Mine was advocacy. I think it's really important to have a platform where you can speak up and stand up for people. Someone mentioned earlier about social justice, and someone else mentioned about police reform. Those are some things that are really important to me. And through public health, you can fight against those things through policy, like it was said before, like making racism a public health crisis, doing things like using preventative methods, like seeing that there's a disparity in communities and doing something about it. And I think that's really important because change is one of the things that I value, like the highest, is being able to impact the change for the good. And through that, I can do it with public health.
All right, let me see. No other hands. Okay, our next question is, so why is the voice of youth important to the field of public health? Normally when you see public health, you see older people. One, because even up until, I think like maybe up until like 3 years ago, public health wasn't even offered in undergrad. It was always considered a graduate program. Now they are off, a lot of universities have transitioned to offer bachelor's degrees in public health, but until then, most college students, especially college students of color, didn't even know what public health was until we got ready for graduate school. But as young people, why is the voice of youth important to public health and how we do and conduct public health? I see Nia, then I see Tomas, then I see Everett.
So I think the youngest ears, or the ears that don't know what to, I guess, look for, have the biggest voices in the room. I think coming to public health, I didn't know anything. I thought that I was here in Michigan Extension. I want to learn. I'm trying to figure out what I'm doing here. And then I get thrown in and I'm like, oh, I get it now. I get why, like, students at Southwestern, I'm seeing them getting put into the pipeline system, but they're not having enough food at home. They're not having services that wrap around what their needs are. I'm seeing like students who may be in the foster care system who aren't being listened to. I'm looking at their public health concerns, and I'm like, this all not making sense. Like there's this system, but then that system, like I'm not seeing the connection, but public health was my connection. It was my way of like saying, oh, this makes sense. This what determines whether or not someone lives or not, where they go to work, how they live, how they interact with community. Like that, I feel like public health was that connection between all, to make everything make sense to me. That's my personal opinion, but yeah.
Okay, who else had their hand up? I think it was one other, Tomas. So again, the question is, why is the voice of youth important to public health?
Well, I think, if we kind of just take a look back in May, when the George Floyd, Breonna Taylor, Vanessa Julian protests and all of that were happening, the youth, we fuel things, we tend to do that. We're the charcoal. So I just feel like, I think if there was a way, like you said, to make more programs, make the branding more known to youth while we're in high school or even elementary, just start getting us to know more information about it at a younger age to get us the, interest and whatnot, especially us youth in marginalized communities, like where I was growing up at, I used to live on the north side, 48505. And just over there, I know just everybody, just like, I don't know. I'm just starting to get a little, I don't know. Basically like, just this, me, I always got to go deep. It's like, you got to, like what's, like Lauren was saying, Miss Lauren, like you got to go at the issue at hand. And that issue is racism, because if you look at it, the schools up the street, Northern And well, Northwestern was the only one, at least in my zip code there, or Beecher. But over there, the textbooks outdated, all of that, and no one is getting this information to be that change. And that's just really sad to me. So I feel like public health, you know, getting us new people, because like I said, young people were making change happen. So maybe if there was a way to like teach us young on, like give us more opportunity, make it more accessible for us youth to be in the public health at a younger age. Because if you look at it now, it's really a lot of older folks, no disrespect whatsoever, but basically we're kind of used to these traditional ways. We're, you know, in Mexico, I know people that go over there to go to the dentist office, go to get their doctor's checkups for free. We don't have that over here. So you know, that just makes me think that us youth, we can make change, because the traditions in the United States, when there was hardly any youth, like you said, in the public health sector, you know, everything's traditional. We're still having to pay for this and that, and people, it's less hard for them to have. So having us youth to change it and make it to where it's accessible for everybody, making a policy, you know, a system. Yeah, that's why I feel like it's important. And like I said, you just really got to combat that racism issue, that marginalizing, redlining, whatever you want, whatever. You got to combat that issue at hand, so then you can start the system.
And that's
rebuilding America.
Yeah, that's the beauty about public health, is that it allows us to address multiple systems and not just individual systems, but we had a show talking about the intersectionality of various systems and then how they play out in people's lives. And so public health gives us the types of frameworks to do that. And then you mentioned something about young people. That's why this academy is important. That's why in a lot of your Flint area leaders in public health, we've been taking young people to the American Public Health Association, the annual meeting, for the last 15 years, and we've been introducing youth. And when they say students that's called APHA. When they say students at APHA, they're meaning graduate students. When we said students, we were bringing middle school and high schoolers so that they can start getting that experience and that exposure to public health. And that's what this academy really is all about. And then there's something that's really phenomenal. Every major movement, so if we really want to see a movement in public health, every major movement in the history of the world was always led by young people. Dr. Martin Luther King and all them, they weren't old when they was doing that stuff. They were young. They were like in their late teens, early 20s, you know. So young people, you know, there's a scripture that says that God calls the old because they're wise and the young because they're strong. The young people are the strong ones that have the ability to knock down on the doors and to do the marches and to do the protests. And so it takes everyone. So yes, it is important that the voice of youth are in public health. Go ahead, Cruz.
Everett, did you want to go first? Because I know you've been waiting.
I didn't see your hand. I'm sorry.
It's all right. Yeah, Tomas and Nia really said it. It's important to the youth because nowadays the youth are being exposed to much more things. Especially when you talk about phones and like social media and stuff like that. These kids are seeing things that they've never seen before, and not knowing or being knowledgeable about these things is really damaging, especially when you talk about like trauma and stuff like that. So it's really important that kids are introduced to public health at early ages so that when they come in contact with these things, that they know how to deal with it. So when they come in contact with depression or sadness, that they know how to handle it. So yeah.
Well said. Well said. Cruz?
So I really like this series because it gives a perspective of youth, right? And when I think of when you make decisions, everyone should be at the table, whether that be any type of section of people or person, they should be there learning, hearing the discussion, and giving their input, because it's going to impact them too. And so when it comes to youth, our first show was about, you know, schools reopening. That's something that definitely impacts youth. But, you know, there wasn't really an outlet for us to have input on that. And through having youth, you know, start to learn more about public health, we gain that strength, we get that voice to, you know, do something about that. I think it's really important to hear everyone out, especially when you're making decisions that could impact them for multiple years. When we look at policy, those things tend to stay in for at least 4 years minimum before anyone decides, you know, cut them out. And so that's going to affect a generation potentially. And so you need to listen to that generation that is going to affect.
Okay, Lauren, Christian, then Naya.
So I think that a lot of young people, I would probably say probably between late elementary school and high school, it's when you start to have a lot of really strong feelings about things. And I think that there's an opportunity there to take young people who are already getting angry about things that they see and giving them an outlet for this is what we can do about this rather than just be angry. There's a field that works specifically with these problems, and there's a conversation going on about this so that you can give someone an outlet to be angry in a constructive way rather than just kind of perpetuate the problem of just having a lot of feelings and not being able to do anything about them.
Go ahead, Christian. Thank you, Lauren. Go ahead, Christian.
I see the youth in public health actually being one of the biggest, factors of, the world changing, because these, the youth is going to be the new doctors, the new athletes, the new politicians, the new, youth directors are going to be from youth. So if we start spreading knowledge to the younger, we can defeat old bad habits such as, just straight up bigotry, just racism and everything like that. We can make changes more because it'll be more on the table and people won't be so denying of it because they're, already set on something. So, knowledge is obviously powerful, very powerful. So if you have, youth exposed to it at a young age, and they're going to be running the world. So if they're exposed to it at a young age, they're going to be set on that and they're going to fight for it. So, and like a lot of people said, there's a lot more stuff. My cat is attacking me. There's a lot more stuff going on here. Say hi. There's a lot more stuff going on. We're allowed to get a lot more information nowadays, especially in, like people said, people are getting angrier earlier, and that can be very powerful. That can make movements happen. So.
Gotcha. Thanks. Nia?
I think there's just two main points I want to make. I remember when I was in Boston for a conference, and we were like at this like presidential, I think there's some kind of library for a president, and they were going through like movements and things that happened during the 70s and 80s. And there was one quote that stood out to me, and it was by Shirley Chisholm, and she said, "If they don't give you a seat, pull up a folding chair. If they don't make this table big enough, put a chair and make it big enough. Stand, whatever you gotta do, but be in that room because you're supposed to be there." I think my other point was we may be young, but like I feel like we need more credit than we actually get, because we can pick up on stuff where y'all just explain it to us. Like I think there's a miscommunication between generations that has been talked about for a very long time, and I think that's what's kind of maybe hindering our progress. That's a whole different conversation, but I think we as young people we can get it. I think we can get it earlier and sooner if there's more communication, if there's more like equity in the communication of like progress we're going to make. So
wonderful, and that intergenerational communication is so important. Go ahead, Kayla.
So I have a 5-year-old sister. I'm just going to tell a really quick story. And the other day I was really, really frustrated trying to figure something out. I won't tell you exactly what it is, what it was, but she walked up to me and she was just like, "Do this." And I was like, "Be quiet." And then 5 minutes later, she came back and she was like, "Do this." And I was like, "Be quiet." Cause I'm like, I'm gonna figure it out. And then she came back and finally I was like, all right, I'm just gonna do it. So she'll leave me alone. And then it worked. And I was upset. You know what? I won't lie. I was like, no, she did not just figure this problem out that I have been sitting here struggling with for so long. But that just goes to show young people have a habit, and I say young people even as a young person. Like, she's 5 and I swear she's a genius, but that's not the point. It's they just see things differently that I could never see. One, because as we get older, the world is teaching us how to think, whether we like it or not. The world is saying, think this way, not this way. This is normal, this is not. This is right, this is wrong. This is how you do it, this is not how you do it. This is how we do it. Anything else is wrong, right? From a very young age, kids are just like, this is the easiest way to do it. This makes sense. This is simple. And so this is why youth have to be involved in these conversations, because when we talk about matters of progress, how much further along would we be if people who have great understandings, vast understandings of the world, spoke to people who maybe don't get it as much, but get creativity, who think outside of the box, who think differently, who haven't been taught how to think. Because I think sometimes our ability to think higher, we call it, blocks us from the opportunity to think differently. And so I think this is why youth have to be a part of this conversation, because we need people who are going to think differently. We have the same conversation. If you go back through it, we have the same conversations over and over and over and over. And sometimes we're proposing the same solutions over and over and over and over. And not only how much progress would we make, but I think someone else mentioned how much further along would we be if a 5-year-old entering college already knew what public health was before they even got the degree. I already know what this is about. You don't have to teach, you don't have to introduce me to public health. Let's start solving things now. You don't have to tell me what's going on in the world. I already know what's going on. But here are the different ways that we can solve it, that I've thought about, that I don't think anybody else has said, because sometimes we just simply miss it. And that is what it is. I mean, like, our brains, only for a certain amount of time are they growing and developing. And then after that, they're falling apart, like, for the rest of our lives. And so let's get these people who are still in the process of developing. Like, how dope is it that your brain is still constantly growing, constantly changing? And how much more can you bring to the table with a developing mind and a changing perception of the world? Because that's another thing. I mean, once we get older, we just be like, this is what it is.
Kayla has preached. We can just take up her an offering and then close the doors of the church. I will say this. One thing that you said resonated with me. One of my mentors, Mrs. Ehil Deloney, has always said, when children are born, from the time they arrive, they are geniuses. And we dumb them down. We stifle their creativity. And so when we think about it, that's why, again, it's important to have youth at the table. Those interns in the Public Health Youth Academy from the beginning know everything that I do it with them, and I ask them to weigh in on the decision. They have the decision holding power. I just make things happen for them. They know how to write grants because they've been writing grants. They know how to make logic models. I don't go off and just do it, right? They can tell you how to do a budget justification, because these are skills that we're setting them up with to win. You know, they know how to do several things. So most of the things that I do, I'm trying to transfer this stuff down, and then I'm finding other mentors in the community who have skill sets I don't have, but I know that the young people have. And then we bring them in, and we're doing this transfer of knowledge, because that's how we build knowledge. That's how we build health. That's how we build equity, but that's how we sustain ourselves as people. So thank you guys for those responses. I want to kind of shift to the fact that public health is such a diverse field. Probably half of the people who work in the field of public health don't necessarily have a public health degree. For example, there are people that have lawyers that have degrees in law, but they focus on health policy pieces. There are those that have degrees in nutrition, and chefs who have big cooking shows, but they do public health work, because we know that nutrition and food is a big part of health. You have, for those of you that are into sports, I have a cousin who wants to be a sports therapist, right? But yet he wants to also be a part of public health, because physical activity. He wants to have a big check coming from the NBA, but he wants to do this sports therapy stuff for young people, right? So that's still public health. If you were working in the transportation, those that drive buses, those that make the decisions about transportation, that's public health. We have a young person on who's not here who wants to be an accountant, but she said, but I want to do stuff dealing with public health services. So grant writing, financial management, all of those things, you need that in public health to monitor and make sure that the programs are being run right fiscally, and that we're making the right reporting to governmental structures and whoever we're getting funds from. And I'm just giving you guys examples. Psychiatrists, right? We have a couple of people that are very interested in mental health. and whether you want to be a psychologist or a psychiatrist, that's public health, right? And then you have those of you who are just good. I have a friend in Ypsilanti that's great in media and communications and marketing. Some of you guys want to do communications marketing. We have to have health communications and health marketing. That's a big niche, what they call a niche in the field of public health, that people are looking for people who can do public health podcasts, who can be the engineers for these types of things, and IT. That's a big thing in public health. And then we also talk about, educator. Some people just want to still be an educator, want to be a teacher. Health education is a big field. So these are all fields that are standalone fields, but who are also central and neutral to public health. And I didn't name them all. Social work, that's a no-brainer. How can you address the social determinants of health if you don't understand social work and the societal frameworks that we have to live within? So that's just an example of it. So as public health is such a diverse field, so what are some ways to maybe, knowing that, what are some other fields that you think should be a part of public health, or that are a part of public health? And then what are ways that we can connect that for young people? One more example, I'm a singer, I'm a musician. So how do I take music and make that a part of public health? How do those that do art and dance and that draw, how can we do that? So I think about Marvin Gaye's song, What's Going On? He put that it was talking about the war. Our parents listened to that. We just thought it was a nice tune, but it had a public health message to it. So how can we infuse those messages into the lyrics, into the bars of the rap song, right? Into all of those things and be creative. So we're gonna ask Nia, and then anybody else that wanna go after her, Everett and Cruz, and then we'll go from there. Go ahead.
I love this question. Yes, like it was Ella Fitzgerald, it was Nina Simone, it was these amazing people like going in, talking about what we need to hear. Personally, I'm a very econ policy, public health person, so I want to go into policy work. Working on small communities, building their agency, taking the principle I learned from Recast to make sure that I'm helping. I'm like more of like I'm gonna help a community help themselves instead of like oversee. Hey, I'm here, but really I still have more strings than I really should have. And I think public health is a really unique thing where you can come as you are, not as we want you to come. And that's the best thing about public health. And for me, I just think that economics is a no-brainer. Like we need black women economists in the room talking about our issues, right? We need policymakers that look like all different kind of people, because we all come from an intersectionality that matters. We all matter. Our humanity matters. Our community matters, and how we come is what matters. So.
Cruz, and then Everett.
I'll go first. Dr. Key kind of stole mine a little bit because I do writing and music. So on the writing angle, I think it's really important that we learn how to get messages out there. And so whether that be as simple as magazines or academic essays or things like that, there needs to be someone who, reports these things to the common people. On top of that, there's music and art, whether that be through creative expression, through visual art, or through Audible or anything like that. I think that's really important because it's part of the culture, and you can't really separate public health from culture. And even if you tried, it would make things less fun. And so, of course, I enjoy, being able to infuse those two things. And then on a last note, I also do video editing. And so I think it's important to get things like commercials or other things like documentaries, things like all those things like that matter because it's how you deliver the message. That's super important to me. And you can't miss that point, because how are you going to help impact the community if the community itself doesn't understand? And I feel like part of the issue is we haven't given them an opportunity to understand. A little bit is because we don't have enough people out there in the field trying to push that narrative. But lastly, it's it's a large gap. I mean, like we were just saying, it's graduate school to learn this type of thing. Now it's undergrad, but you know that's a secondary education, and so not everybody has possible access to that, and so it should be delivered or told to them in some sort of way. And so you can do almost whatever you want to do and still relate it to public health. And I think it's important that more people see it that way.
Absolutely. Everett, and then Jasmine.
Yeah, I think it's really important that we start to see public health as everything, like we've been saying. Especially when it comes to like infusing it more into just daily life. Like when you talked about the music, we got rappers out here who usually make trap music. Like Lil Baby, for instance, he usually makes trap music, but he put out a song called "The Bigger Picture" where he talked about social justice issues. And I think that was really important because his audience isn't these people who are out here like really involved in social justice. So I think it's really important that when he put out that song, he opened their eyes to something that they've never really seen before. And that's important. You see it in everything. You see it in movies, you see it in TV, you see it in music, magazines, like you see it in everything, art. So I think it's important, like as we progress and as we become like society again, that it's important that we start infusing public health and just learning in general back into everyday life.
You're muted.
Jasmine, and then I'm going to call on Kiera. I'm going to put her on the spot only because I'm so proud of her because she's been a part of a lot of the youth programs in the city, and now she's in law school, and she can kind of talk about connecting public health to law. Go ahead, Jasmine.
All right, let me make it quick because I want to hear Kiera too. I want to talk about a few professions. So, of course, being a person who wants to get another degree in mental health, I think being a psychologist with a background in public health could really be important for population mental health, especially as it comes to policy, as it comes to anti-racism work. Another one that I always think about is engineers, just because of our built environment. And it's like they can literally change the game as far as a zip code. And then finally, just because I absolutely love comedy, comedians, I think we've seen it in the pandemic especially, but just sharing their experiences, for example, with COVID and helping people to feel less stigmatized for sharing their diagnosis, which means, of course, contact tracing can happen, things like that. Also, just normalizing things like vaccines or talking about the past without seatbelts, and making light of a situation that can really connect with people. I think comedians have a exciting role in public health.
I would agree. And before Kiera comes on, you mentioned something about engineers. So you guys know most of us are from Flint, have lived in Flint, and the water crisis happened. And they were talking about this engineering standard rule called the lead and copper rule, right? And the lead and copper rule detects how much lead is allowed in drinking water. Where for most of us, we're probably thinking, how about none should be allowed in drinking water? Probably your 5-year-old sister, Kayla, would probably be like, duh, none, right? But those are engineering standards that the federal government mandates and regulates. And no public health or no medical professionals were at those tables when those engineering standards were created. So imagine other stuff around air quality, how many emissions can be let in the air. What other regulations should public health folk have been at the table or medical folk been at the table that we were not at? So just think about that. You just kind of triggered that thought for me, Jasmine. Okay, I'm going to go to Kiera and then Tiana.
Okay, hey everyone. So like Dr. Key did say, I was in a lot of programs in Flint when I was growing up. And so when you think about public health, of course, one of the first things is mental health. And just as I'm wrapping up my first semester, and I'm thinking about like why I'm even here, being in all the programs growing up and having those connections with people who did have a higher education and went through what I'm going through now is really the only reason why I'm doing it. And in med school and law school now, it's mandatory that you have to go to the counsel center or check in with the counsel center and stuff like that. And I do think you won't make it through without doing that. And more importantly, without recognizing that you need to do it and why it's important to go and talk to somebody, make sure that you're okay, because your norm may not be the norm. You know, you could sit and just be talking to somebody about something and not even realize you're saying something that's absolutely detrimental to your health, and you think it's normal. One of my biggest issues was eating. I get busy, I get stressed, and I don't eat. It's not an active thought like I'm not about to eat today. It's number one, I don't have the time, and number two, when I'm busy or I'm trying to get something done, I don't really have an appetite. You know, I have a one-track mind to get whatever it is done, and then I realize it's 6 o'clock and I've just had my first meal of the day. I actually just ate well, I had a smoothie though earlier. Jasmine saw me making smoothies earlier this week, and that's because I know it's finals and I know that I won't eat. So what I did do is I made a bunch of smoothies and put them in my refrigerator. So I had my first physical meal, like my first, you know, solid food, or, you know, when my camera was off actually, but I did have 2 smoothies today had protein and vegetables and fruits. Aside from that, I think I have 6 classmates that are actual doctors. And I'm a paralegal, and I barely made it through the semester. So I don't understand how they practice in medicine and actually want to be in law school. And I talked to a couple of them. There are 2 that are minorities. And the biggest deal is the way the insurance companies and policies are being made right now. There is an adverse effect on so many groups of people. Of course, minority people, but a larger group of just poor people. A lot of us are poor and minority, but it's complicated. And what they're telling me is it's not the doctors coming up with these things. And a lot of times it's making the doctors work harder because they're trying to help a patient, and this patient does not have the resources to help. They're giving suggestions that the patients don't have the resources to do. So it's like me, you know, when I get to practice in law, if I tell a client to go do something and they don't have the resources what's the example? If I tell a client, I need you to print out 300 pages of documents, I can't do it here for you. I need you to go print out 300 pages, and you have to take that to your boss or you're going to get fired. And they don't have the capacity to print out 300 pages. So I'm just sitting looking at them, and they're just looking at me, and I'm billing them for it. You see what I'm saying? And so that's exactly what doctors go through. And all of the other factors, as you said, you know, your zip code that come in, your environment, your family history and stuff like that, that affects your ability to advocate for yourself and be healthy. So there are a couple of the doctors that are doing, there's a farm program. There's a joint JD farm program, and there's one girl that is doing that. 2 of them are doing the Master of Public Health, and 2 of them want to work in pharmaceutical regulations, which is different than retail. Retail is when we go pick up our prescriptions at the store, stuff like that. Regulations is, you know, making the rules, setting the rules. And then also there's a side of the real scientists that test, you know, that do the testing. But there's a lot of ways to incorporate public health in the law, because I really do think that's what it boils down to. I mean, as you said, when they were making the laws about what is allowable lead limit, you know, like there was not a scientist that said that was okay, you know, and a lot of the regulations that are established for health do not have adequate medical professionals helping to make those decisions. So yeah.
Thanks, Kiera. That's powerful. Tiana?
Please excuse the puppy in the background if he starts barking. But we're talking about how public health infiltrates all aspects of life and the different industries or backgrounds that you can work with public health. But I also think it's very important to emphasize that as a constituent and community member, your job doesn't have to be the reason why you're interested in public health. It can quite simply just be because you are a U.S. citizen. It can simply be because you're here and you see that there is a problem that needs to be fixed. And that's really where it's important for us to be engaged and to vote and to advocate for ourselves, because while there might be people who are in a position to advocate for us, sometimes that doesn't always happen. So I also wanted to emphasize how important it is just as a citizen just to be engaged.
Absolutely. And you guys will see us snapping our fingers. So, those of us that do poetry and music, that's our way of affirming without making a loud clap. That's our applause. So I'm going to boil down to our last question because we're coming up on an hour. Many of you are in the Flint Public Health Academy. We have a couple of guests from the WOW Youth Ambassadors Program. So my question is, how has FIRE or WOW made an impact in your life? And if so, how? So has FIRE or WOW made an impact in your life? And if so, how? Amir, and then Everett, and then Naya.
I think it has very well impacted my life because since it's given me the tools that I need to know, like extra tools also on top of, me trying to study physical therapy and all the other type of stuff, actually going in and being active in the community and really trying to affect how outcomes are and help the quality of life of people in general, because I love people. So I think that's what it's done. And also the different tools like grant writing and everything like that, I had no idea before, entering this program on how to do that or any type of stuff. So it gave me a really good tool to establish in my life and carry on for the future.
Tomas, and then Naya. And then I think Everett had his hand up too, I thought. Go ahead, Tomas.
The group is important to me because it actually demonstrates to me about how our voice can actually be heard and how impactful it is. Because I was always told that, youth and, voice impact and whatnot. But me, I didn't always believe, like Thomas, the disciple, the doubter Tomas, the Mexican disciple. So me, I always was doubting stuff, not thinking this was true and all of that. And I'm like, oh, well, it's only going to get in Genesee County. That's it, But I've just really realized how far our voices actually reach, and then knowing that, the true definition of public health, because me, I'm kind of undecided. I either want to be an architect or a lawyer or politician, just something. I want something with like a leadership quality, and the Flint Public Health Youth Academy has taught me, about how the intersectionality, how everyone is saying, with public health and leadership, so it's like no matter what I do, what I aspire to be, I'm gonna be giving back to my community. There's a way to do that. So I feel like the group has really, demonstrated to me how powerful our voices actually are, and kind of more ways, ideas, and how I can help my community back. Because that's what I want to do. I want to help my raza out there and my everybody, period. So
I'm going to change the order. I'm going to go Naya and then Everett, because I know she has to go, and then Quavius. And then I think Tiana's hand is up again, and then Cruz. Go ahead.
Yeah, I'll be very quick. Thank you for this opportunity again, Dr. Key. I think my first interaction, my continuing interaction and continue support and however can help with WOW was Kenyatta Dawson, and she's an amazing activist. We have worked together for numerous things, and when I first got back to film, which is an interesting zip code story, she was my first kind of exposure to gun violence in the city, because I knew about, I always knew about it, but I was also sheltered from it. And just having that other generation of to teach me this how this issue has impacted me, impacted my family, and impacted my entire community. So I feel like WOW has this tremendous amount of people backing it that just keep on pouring, keep on giving, keep on serving, that I just continually just am in awe of.
Wonderful. We'll go Everett and then Aquavius.
So fire has impacted me in so many ways. But I have to say the biggest way is giving me another outlet, not only to help people, but to continue learning. I think that the best way to elevate in life is by getting educated and then execution. And Fire has definitely taught me a lot about public health, and like I've become more and more educated, and I will continue to be more and more educated as this goes on, as well as how to execute. So like you can't just see a problem, learn about the problem, and then not do anything about it. Fire has taught us how to get down and get in the groundwork and like take care of stuff the right way. So yeah.
Thank you. Quavius?
Well, the way that YA has impacted me, well, I wasn't even gonna go to YA. I don't know what I'd be doing right now. Like I'd probably be sitting down, doing nothing. And we have meetings every Wednesday. And when we first were told that we were gonna do those, I was not gonna go. But then I sat down and thought about it, and I was like, if I don't go, I'm not gonna be part of YA, which is we play basketball too. So I'm like, dang, if I don't go, I ain't gonna be able to play basketball anymore. So I was like, I'm gonna go try it out, see how it is. So I went, and it was pretty nice, and I liked it. We discussed a various amount of topics, and like I just I started to like it, and like I started to understand more, and I started learning a lot. And I wouldn't even be here right now if I didn't go to YA on Wednesday. This Wednesday actually, we got Coach Omar, Mr. Omar Young, he sent us a message saying that he wanted us here, no questions asked. I was like, all right. And that's a person I respect, so I'm gonna do whatever he asks me. So I came, and I'm liking it. So without YA, I don't know where I'd be right now, like in general.
Wonderful. That's great. Did anyone else want to go? Alonzo, and then Cruz, and then Kayla.
Just to piggyback off what Aquavius said, like when I first went to YA, I didn't think I was gonna like it. But then once I started to sit down, actually listen to everything they were saying, like they were just explaining everything. And like it kind of actually helped me. It helped me understand better. It helped me it just helped me a lot. So like I'm starting to understand everything more. My mind is starting to become more open, and I can just understand everything like way better than I was able to do before. So, yeah.
Great.
Yeah, like how some of the other Fire members have been saying, it's given me valuable skills. But what is the most valuable to me is the way that it's helped shift my thinking, and I got another extra angle on it. I think it's really important to start seeing big picture things, and Fire has been able to help me see that. When it comes to like, there's so many people who work hard to impact change, and it's so easy to not be aware of them because they're not talked about. And so I was able to learn about all those different positions and people who are really trying to help, and how I can help, bring them together with other different people, and continue to assist them in trying to make a positive change.
Great. Kayla?
Yeah, so for me, I would say two things. First, I would say the platform that Faya has given me has been amazing. And oftentimes I think that's the hardest part for people. Like there are a lot of people who have great things to say, but no one to say it to, or no platform to say it on. And so I would say that has been a beautiful addition of this experience, is the ability to not only have important conversations with other youth, which I had been fortunate enough to participate in prior to this opportunity, but having difficult conversations with youth on a platform so that people can hear and can look back at it and can continue to speak about it. Even our opinions, and enact change based on our opinions. So I would say that's the first thing, is the platform has been amazing, and has been it's been an honor to sit on this platform with my peers and with our mentors. But I will also say I get energy from this. Like, this is fun for me. I love to talk, and I love hearing y'all talk. I be like, this is fun. We sitting, we chilling, we're having a conversation. I've been able to meet people, and I'm like, man, because I think especially in the era of COVID and the era of this beautiful revolution that we're in right now, it's easy to get bogged down by everything and to feel like everything is just bad, like everything is just horrible. But I come here and I'm like, no, like there are people who are working. There are people who are fun. There are people who have bright futures and have bright ideas for the world. And it's just a matter of waiting on them to explode out of this youthhood phase of their lives. And so this is fun for me, and I've enjoyed being able to connect with other youth and just have a little positivity in my week.
Wonderful. Anyone else want to say something before we close out? Christian?
Cruz and Kayla nailed what I was about to say, but I'd also add, it gave me more perspective. And I love hearing about other people's perspectives. I love hearing about what they have to go through, what they've been through. And this, it's been a great experience working with everyone in the group. Love it, absolutely. And just knowing that, I can truly understand what people are going through by their own voice, because everyone has a voice. And for them to see it specifically and in their own way, it's just more and more stuff for me to understand, more things for me to learn, more things for me to, take on through my life and how I have, perspective on things. So I greatly appreciate it.
Wonderful. Anyone else? Final remarks? Jasmine?
So I've only served as a mentor for a few months, but similar to what everyone is saying, this is such an amazing opportunity just to learn, to be a resource, to connect, to get to know so many bright young people, to be mentored by Dr. Key. This is wonderful. So I count it as a blessing.
So, and that's one of the major things of the Academy. It's the Flint Public Health Youth Academy. It's exposing and introducing young people to public health. It's creating opportunities for them to get engaged with other young people and actually peer mentor other young people. And that's what we're doing with WOW Outreach. Our young people have been peer mentoring them and other youth groups with Youth Quest and so many others. But the other thing is to actually just saturate you all with mentors, right? Because some of you may be first-time college students, or your parents may not have gone to college, or even if they did, you're going to need different types of mentors for the rest of your life. Like I have lifelong mentors. My mentors don't end just because the program is over. Like they're still my mentors. And so it's important to have that mentorship and to have people who have social capital as well as networks that they can tap into on your behalf to make things happen. And so that's what we're doing with the Flint Public Health Youth Academy, along with our curriculum and teaching you the science and understanding public health. It's really creating that support system and that network to launch you hopefully into some type of career in public health, or a connection to whatever career that you're wanting to go in with public health. But the overall goal is so that we can have healthier communities and live our best lives. So thanks everyone out there in social media land for tuning into another episode of A Youth Perspective. We are the Flint Public Health Youth Academy. Join us every other Friday at 6:30 p.m. live on Facebook at 6:30 on our channel. We look to see you next time. Have a good evening.